Namaskar, welcome to the True Hunt. And as we are aware that the month of January is known as a cervical cancer awareness month internationally, which is recognized by the WHO. And in this month, with things related to cervical cancer, is to get informed, get screened, and get vaccinated as a part of awareness. So we have got Dr. Ashok Ratan with us, who would be discussing the human papilloma virus high risk causing cervical cancer. Dr. Ashok Ratan, who has been an ex-WHO laboratory director and is currently heading as a chairman of the medical committee of Redcliffe Labs, and also he's a visiting professor and mentor AHRO University, Glasgow, Scotland. Sir, welcome to the True Hunt. Please highlight that what this HPV infection is all about.
I think about HPV and the cancer that it causes. I wonder how we react, because this is a cancer which is very frequent but 100% preventable. It was in 1952 that cervical cells from a lady were taken, and this was the first time when the cells could be cultured and they could grow forever in vitro in cell lines. So cell lines, they became known as HeLa cell lines, and many researchers were using this. Then it was in 1984 that Fossen in Germany identified that there was part of HPV virus which was present in HeLa cells, and that was the reason for cancer. Since then, HPV has been associated with cervical cancer. Now we know that there are about 223 different genotypes of human papilloma virus, but only 12 have been associated with cervical cancer. The association with cervical cancer is nearly 99%. So nearly all cervical cancer in different parts of the world are caused by human papilloma virus. Initially, it was thought that only genotype 16 and 18 cause a majority of the infections. Now we know a few others can also cause. The good point is that there is a long distance between infection and cancer. So that gives us opportunity. One is either we can give vaccination, and now even Serum Institute of India has been able to manufacture a 4-valent vaccine. There were vaccines available in the West for a long time, and they have changed the trajectory of deaths because of cervical cancer. And the second one was that when a person has infection, if you identify the infection and give treatment, you can prevent deaths due to cervical cancer. So one could be primary prevention, that means vaccination. The second one is that after infection has occurred, if you identify and then you treat, then also you can prevent death. So that is secondary prevention. And the third one is once the disease has set in, if you treat them, still you can prevent death. So that is tertiary prevention. So it could be any one of them could be used. But the tragedy is that in India, last year, 77,000 women died because of cervical cancer.
Sir, before going ahead, especially I would like to ask about, of course, why the ratio of women is so much. Before that, sir, reasons of poor uptake in India I'm talking about. When we are well known about the disease which is existing and which has been proven, as you have told that previously, reports have also been published in some of the journals. So, sir, what is the reason of poor uptake till now?
Many guesstimates have been made. It's been suggested that lack of awareness is one of the commonest causes. That can explain, maybe intuitively, that can explain why the uptake in the rural area is not very high. But in urban area, when you talk to gynecologists, many of them themselves have not undergone the screening. So I think there is hesitancy. There is something holding it back, and we are not understanding. And or maybe it is ease of sample collection. That is why, though they say it is multiple factors which prevent, but I noticed that even in urban area, only about 2% of the eligible women have been screened. And there are 3 different methods available. One is the Pap smear. Pap smear in the West has been tremendously helpful. Normally, it used to be 40 per 100,000 people used to suffer from cervical cancer in the West. Now it is less than 2 per 100,000. But that needs to be done every 3 years after a person becomes 21 years of age. That means there are about 17 times he has to come to the hospital, which is not possible in India. It's also been noticed that infections occur once a person becomes sexually active. But in the first few years, the woman can get rid of the infection. So the immunity can clear the infection. That means testing should not occur early. It should occur so that we prevent cancer. And that means by the age of 30.
If we talk about the woman part, why there is so much of lagging in the awareness that women are not coming forward and in comparison to urban and rural population in India? So what would you like to say?
As I said, intuitively, they've said that in the rural area, one is that since there is no Government of India scheme to identify persons with cervical cancer and treat them and prevent them, that is one of the reasons. The second one is that they are not aware. The third is the infection is asymptomatic. There are no symptoms in the initial stage when the infection is festering. Only when cancer is established that a person starts feeling something or the other. Other reasons are that it's not convenient. There are taboos. There are persons don't talk about going to the gynecologist, or the gynecologists are not available. In the urban area, though gynecologists are there, people are aware, still there is reluctance. So we have been feeling that maybe if we can ease the collection of sample and we find that first voided urine could
Right.
act as a surrogate. And our own finding is that people have no hesitation in giving urine for culture. For culture, we need midstream urine. But for detection of cervical cancer, we need early voided urine. That means the first voided urine. We are not interested in urine. Urine is a vehicle which will carry the exfoliated cells of the cervix. The exfoliated cells of the cervix collect around the urethra. So when the urine is passed, that is the time when it is a natural flushing system of the genital secretions. They are collected, where in the lab we can centrifuge the cells and then detect. So we feel that this method might be able to ease the hesitancy. In the West, people are very aware. In India, as I said, urban people are aware. Even urban, at least the technical or the medically qualified persons will all be aware that HPV causes cervical cancer and this cancer is preventable.
Sir, my question is, of course, as you were talking about that the medical people are aware, and of course the urban people are aware, because the education plays a big role in the awareness. So, sir, if we talk about rural India, no doubts now we are touching the rural roots as well, making them more modernized, connected with the cities in a better way. So, sir, I would like to ask you that how, in layman terms, the medical sector or the health sector could play a role to make its reach to every citizen in India, whether he is literate or not literate, but the awareness should reach the doorsteps of the people. So, what can be done in that scenario for awareness of this deadly cervical cancer disease?
Many non-government organizations hold camps and health camp for the women, and along with that they then do cervical examination. But of course the uptake is not very good, and what happens is that there are three methods available. One is by visual examination, and normally what is there is that diluted acetic acid or lugalcidine is applied, and if there is precancerous condition, there will be change in color. So by looking at that, a healthcare professional will be able to say whether the cervix is healthy or it is diseased. But many women are not willing to undergo that testing, and it is not a very sensitive technique. The second one is Pap smear, where the healthcare professional collects the cells and sends it to the lab. And the third one is, as we are proposing, that if you take the urine, which a woman can give in the privacy of her own house, and that can be tested, and if found positive, then must be treated. While if it is negative, then for 5 years, nothing else needs to be done, because the infection can be picked up and is more sensitive than any other method. By if you detect high risk HPV virus, then we can give a guarantee of no cancer in the next 5 years. That would mean that the testing should not begin before 30 years of age. So
As
between
you
30 and
said before.
35, one testing, and between 40 and 45, another testing. And that will ensure that the person does not suffer from cervical cancer, or if infection has occurred, then it is attended to, and that will fulfill the requirement of WHO that if together with vaccination and together with treatment, prevention of cervical cancer is all completely possible, and is possible to decrease the deaths which occur as a consequence of cervical cancer.
Sir, my question to you, is there a ratio that this cervical cancer in women is higher as compared to men, or it is equally seen in both?
Cervical cancer seems to be very common in women, but men are also subjected to infection, though the associated with papillomas, with warts, it's associated with laryngeal cancer, it is associated with penile cancer. So infections in men also occur, but the association is not as strongly linked as with cervical cancer.
Sir, what about the adolescents? How this cancer is, harming them as well?
The virus is transmitted from one person to another person through sexual intercourse. So
Okay.
once a person becomes sexually active, then it is transmitted. In case of cervix, it is the basement membrane of the cervix which is affected. Basement membrane is actually hidden by a number of cells. So there must be some minor abrasions in the cervix before the virus gets in. This virus is not present in the blood. This virus is only from cell to cell interaction.
So, sir, how this is
That is,
transmitted into children by the parents, or?
yes, in the warts occur because of skin to skin contact. Whenever there's any injury, then the virus can get in, and that's why it occurs in the hands, in the neck, etc. So
Yes.
persons who play a lot of wrestling and contact, they can also have warts. Normally, it is best to give vaccination by 12 years of age, whether boy or girl. If they
Okay.
are vaccinated by 12 years of age, then it will prevent infection in them. So children don't suffer from it, but
Okay.
yes, they can have warts.
Sir, of course, you have provided a new solution with the urine test and stuff. So, my last words that, of course, it is a collaboration of our government and NGOs, as you also talked about. They're working in the rural areas. So, what else can be done in this scenario to make this awareness program about this cervical cancer more successful, effectively implemented in all parts of India?
One is to increase awareness to all children that there is link between virus and cancer, and that this link is preventable. I think so let's increase the awareness
Yes.
and increase that it is preventable and it is treatable.
This was Dr. Ashok Ratan with us, who has thrown a light on the cervical cancer caused by a high risk HPV infection. Thank you so much, sir.
Vaishnavi.